What is sore throat? Causes, symptoms, and treatment. A theoretical about science and medicine prepared by editors of a page all scientific. What are tonsils? Tonsils are a collection of lymphatic tissue located at the back of the mouth. The main role of tonsils is to produce antibody to protect the child from respiratory infection. When this tissue becomes inflamed, a sore throat, acute tonsillitis, occurs. Who gets sore throat most often? Sore throat most often affects children between the age of 3 and 7, when the tonsils are especially important for the body. With age, the tonsils atrophy and such infection become less common. Typically, a sore throat is not accompanied by complication, with the exception of a peritonsillar abscess. In such situations, swelling of the tonsils can even cause respiratory arrest in a child. Complications of acute tonsillitis also include secondary ear infection, problem with the adenoids. Symptoms of sore throat: severe sore throat, inflammation and enlargement of the tonsils, characteristic discharge of a white spot on the tonsils, mild fever, headache, inflammation of submandibular lymph nodes, they become enlarged and painful. Symptoms of peritonsillar abscess. The main signs of peritonsillar abscess, Phlegmonous tonsillitis, are, in addition to the symptoms of tonsillitis, sudden and sharp pain in the throat when palpating the soft palate and floor of the mouth, difficulty swallowing, very violent speech, as if the child is talking with their mouth full, which is associated with swelling from the abscess. When should you see a doctor for tonsillitis? If your child's low signs of a sore throat, acute tonsillitis, if a sick child exhibits increased salivation or difficulty breathing, which may be the cause of peritonsillitis. If a child exhibits difficulty breathing or night during sleep, nausea, breathing, snoring during sleep, these signs indicate adenoid problem or enlarged tonsils. If antibiotic therapy is ineffective and pain and fever do not subside. In addition, if white spot or discharge from the tonsils persist, the patient may have infection mononucleosis. Cause of acute tonsillitis. The majority of cases of sore throat or peritonsillitis in elementary school children are caused by Streptococcus. This bacterium also causes Streptococcal pharyngitis. Sometimes tonsillitis is associated with influenza or cold viruses. Diagnosis of acute sore throat. To monitor your child's tonsils, it is recommended to do a simple oral exam at home. Use the handle of a spoon, pressing on the tongue, and ask your child to say ah. Also use a light source to visualize the tonsils. If the tonsils are bright red and inflamed, then you and your child should see a doctor. A pediatrician will examine your child's throat and take a throat swab to check the streptococcal pharyngitis. The diagnosis of peritonsillitis is based on examination of the tonsils and soft palate. If an abscess is detected, the doctor will drain the pus. Treatment of sore throat. Antibiotics. For streptococcal infection, the doctor will prescribe one of these antibiotics, erythromycin, penicillin. When treating streptococcal infection, it is crucial to adhere to the dosage and duration of treatment. Otherwise, streptococcus can cause serious autoimmune disorder, acute articular rheumatism or nephritis. Treatment of sore throat. Paracetamol. To reduce pain, some pediatricians prescribe paracetamol. Caution: never give your child aspirin, acetyl salicylic acid, which has been associated with Rey syndrome. Treatment of sore throat. Tonsillectomy. Severe cases of tonsillitis may require surgery. Tonsillectomy. Folk remedy for treating a sore throat. Some folk remedy can help with tonsillitis, but doctor advise against taking this risk under underlying cause of is identified. If a throat swab test reveals the presence of Streptococcus, antibiotics are essential, and if it's peritonsillar abscess, you should consult a doctor immediately. Treatment of sore throat, acupressure and acupuncture. Chinese medicine practitioners prescribe acupressure to reduce pain and acupuncture to prevent chronic sore throat for some throats. Treatment of sore throat, honeysuckle and forsythia. They also recommend the honeysuckle and forsythia based remedy for the early stage of acute tonsillitis. Caution: this treatment should only be used in the early stage of the disease and only after consult a doctor. Treatment of sore throat, tea from clovers. Clover's tea can help reduce inflammation. To do this, add 1 teaspoon of dried herb to a cup of boiling water. Treatment of sore throat, sage tea. Gargle with sage tea. It's very effective in fighting infection. To do this, add 2 teaspoons of this herb to a cup of boiling water and let it sleep for 10 minutes. Rinse your mouth with warm tea several times a day for 5 minutes at a time. Treatment of sore throat, homeopathy. After determining the stage and type of tonsillitis, acute or chronic, homeopaths typically prescribe the following remedy for inflamed tonsils: Mercurius vivus, Hepar sulphuris. Belladonna for enlarged tonsils, Calcarea carbonica, Baryta carbonica. Treatment of sore throats, osteopathy. Osteopaths use the same method as regular physicians to treat tonsillitis and peritonsillitis, as well as soft tissue technique to stimulate drainage. What can be done for tonsillitis at home? Rinse with brine. Gargle with brine to relieve throat pain. To do this, add 1 teaspoon of salt to a glass of warm water. You can use this remedy whenever needed. What can you do for a sore throat at home? Ice cream or frozen yogurt. Ice cream or frozen yogurt can be used after tonsillectomy to reduce pain and soothe the child. What can you do for a sore throat at home? Using a humidifier. Using a humidifier with cool mist will help increase the humidity in the room, thereby relieving a sore throat. Caution: do not direct this mist direct at the child. Prevention of tonsillitis. Surgery, tonsillectomy used to prevent frequent recurrence of sore throat. Nowadays, doctors have become less likely to use this treatment method, using it only in serious cases, for example, peritonsillar abscess. If surgery is required, the child will be hospitalized for 1-2 days and the sore throat should resolve within 4-5 days. Thank you for your attention. This material was prepared by editors of the page All Scientific. Attention, this material is for information purposes only. When observing various unusual symptoms, it is recommended to consult a doctor. Subscribe to our channel. Thank you. Bye bye.